Have you heard about nurses teaching doctors how to perform colonoscopies in Denmark?
Wait, really? Nurses teaching doctors?
Yeah, it's happening in Randers. It's pretty amazing, actually.
That's not something you hear about every day. How did that start?
Well, back in 2012, there was this national program for training nurses in colonoscopy. But they realized that the younger doctors didn't have the same structured training.
So the nurses stepped in to fill that gap?
Exactly.
Wow.
A nurse named Hanna Lindberg Havam noticed the issue and thought, why not have experienced nurses mentor the new doctors?
That's brilliant. But were the doctors okay with that?
At first, some of the younger doctors were a bit skeptical. I mean,
Yeah.
it's not traditional for nurses to train doctors, right?
True, but it sounds like it worked out.
It did. Now everyone sees the benefits. The doctors get hands-on training, the nurses stay sharp, and patients receive better care.
It's like a win-win-win situation.
Exactly. And it even breaks down the traditional hierarchies in the hospital.
I bet it improves teamwork too.
Absolutely. When they work closely together, it strengthens their professional relationships.
So, how does the training actually work?
The nurses supervise the doctors during colonoscopies. They provide guidance, share tips, and help them navigate tricky situations.
Kind of like mentors on the spot?
Yes, and the doctors appreciate having someone experienced by their side.
Makes sense. It's probably less intimidating than figuring it out alone.
Definitely. One doctor mentioned how valuable it is to have a nurse's perspective during procedures.
That's so cool. But doesn't it blur the lines between their roles?
In a good way, though. It fosters collaboration and mutual respect.
I guess when everyone focuses on patient care, roles become less rigid.
Exactly. It's all about what's best for the patient.
You know, this could be a model for other hospitals.
It really could. Sharing knowledge across professions benefits everyone.
I'm just imagining the initial reactions. Wait, you're telling me a nurse will teach me?
Haha, right? But once they see the value, they come around.
It's a good lesson in keeping an open mind.
For sure. And it's not just about skills. It's also about improving communication and understanding between nurses and doctors.
That could reduce conflicts and misunderstandings.
Exactly. Better teamwork leads to better patient outcomes.
Do you think this approach could apply to other procedures?
Possibly. Anywhere there's overlap in skills, there's potential for shared training.
It challenges the traditional hierarchies in medicine.
It does. But in a way that promotes mutual growth.
I love that. It's progressive and patient-centered.
Absolutely. And the nurses feel more valued too.
That's important. Feeling appreciated boosts morale.
Exactly.
Right.
One nurse mentioned how mentoring helped her reflect on her own practice.
So it's a learning experience on both sides.
Definitely. And it keeps everyone on their toes.
I wish more places adopted this mindset.
Me too.
Yeah.
It's all about collaboration over competition.
So true. Maybe this is the future of healthcare teams.
Let's hope so. It's like they say, 2 heads are better than 1.
Especially when both are focused on the patient's well-being.
Exactly. At the end of the day, that's what matters most.
Couldn't agree more.
So, next time you hear about unconventional training methods, maybe there's something to it.
Absolutely. We could all learn a thing or two from Randers.
Indeed. It's
Yeah.
inspiring to see such innovation in healthcare.
Well, this has been enlightening. Thanks for sharing.
My pleasure. Always happy to talk about positive changes in the world.
Let's keep an eye out for more stories like this.
Definitely. Until next time.